Hi everybody. I wanted to talk today about vitamin D. A lot of you know that I have a focus on integrative medicine with mental health, and so I want to make sure that I'm sharing information with you that gives you a good picture of things that will help whole body wellness and impact positively your mental health as well. So vitamin D is one of those. Many of us know that vitamin D is a supplement that's added to milk as a way to help our bodies absorb calcium. We know the connection between vitamin D and sunlight. Those that live in areas where there's less sunlight tend to be more deficient in vitamin D. But ironically, I live in Arizona where we get sun pretty much every day of the year, and we're even showing high levels of deficiency in our area. So just because you live in a sunny area doesn't mean you're going to have adequate levels of vitamin D. So it's really important to get your vitamin D checked, and we'll talk a little bit more about that at the end of this. So the connection between vitamin D and mental health. There's a lot of research that shows a connection between vitamin D deficiency and depression, bipolar disorder, schizophrenia. And then on the flip side, studies have been done to give vitamin D supplements to individuals who are dealing with depression, and their depression symptoms actually reduced. So we're seeing connections on both sides of it. And so many times vitamin D is considered a natural antidepressant. Looking at the physical side, there's a lot of research that shows that vitamin D helps the immune system fend off and prevent respiratory infections. So a lot of researchers have been looking at the connection of vitamin D recently with the COVID-19 disease. And studies have been done in China, in South Korea, in the Philippines, the UK, Switzerland, the United States, looking at a lot of the data, doing data analysis. Northwestern University in particular has been doing some of this, and looking at the connection between the deficiency of vitamin D and the serious complications of COVID-19 and also death. And they're finding a strong correlation between the deficiency and those complications and death, so much so that they make a recommendation that vitamin D supplementation would be a great preventative measure. Not that it's going to stop you from getting it, but they're seeing enough of the results that they believe it would at least reduce the symptoms of the disease itself. The Northwestern University research, they even said they discovered a strong correlation between vitamin D levels and the cytokine storm. So a lot of you have probably been hearing that in the news. The cytokine storm is when your immune system basically overreacts to an infection or virus that's going on. So their research is showing that the vitamin D deficiency is showing a correlation with that. And so people who have higher levels of vitamin D are in their systems are showing that they're not having that same reaction, that same response. So I find it interesting just to go through that, and I want to share that with you guys. I think it's important to talk with your primary care physician, or if you deal with a naturopath, and find out what your vitamin D levels are. To get a blood test, it's a simple thing, and find out what your levels are to get you at a therapeutic level. It's important to know that vitamin D is a fat-soluble vitamin, so it will store in the body, so you don't want to overdo it. It's not like vitamin C that you can take a ton of it and it just flushes out of your system whenever you don't use. You want to make sure that you're not overdoing it because there can be complications. But it's an important enough supplement that it's key to know how it can contribute to your health, your overall well-being, your mental health, and as we're facing the reality of dealing with this virus as well. So just wanted to share that with you guys, and I'll try to bring more information like this to you throughout the weeks, and hope you all are doing well. I'll talk to you soon. Bye.